Hello again. Welcome to my channel, Healthcare Insights with Dr. Steven. It's good to have you back again. In this video, we're going to go over some helpful tips on how you might think about managing you or your loved ones' medications. If you're on multiple prescriptions, taking your medications as prescribed is important in order to obtain the maximum benefits from them. It's important to be sure you're taking the correct amount of each medication and that you're doing so at the correct frequency and time intervals. The more prescriptions a person takes, the more likely they are to miss a dose or experience side effects. Generally speaking, if you or a loved one take more than a couple different medications, it becomes harder to manage them, especially if each one has to be taken at a different time of day or at a different time interval. There's also a greater risk of interactions between medications when multiple medications are being taken. Let's talk about a few tips for managing multiple prescriptions at the same time. Number 1, use pillboxes. Pillboxes are inexpensive plastic containers divided into different components. They can be found at just about any pharmacy or drugstore. They're usually inexpensive, and the relatively small cost is worth it in comparison to the wonders it can do for organizing your medication regimen. Choose one that matches you or your loved one's medication schedule. It's best to choose a pill box that has separate slots for each day of the week as well as specific subcompartments for the general times of day when each of the medications are due. As long as your multiple prescriptions don't require special storage conditions such as refrigeration, you can set up the box for the entire week or any fraction of a week thereof that's convenient for you. Setting up your prescriptions each day for the whole day also works. This helps ensure that each prescription will be taken in the right quantity and at the right time. Number 2, set up a reminder system. Setting up all your prescriptions in a pill box won't do you or your loved one much good if you forget to take them when they're due. So, schedule alarms on your cell phone for audible and/or visual reminders to take your medications at the prescribed times of day. Of course, if you prefer something other than using your cell phone as a reminder, such as posting notes on your refrigerator door, that'll work too. The important thing is that your reminder system works for you. Number 3, use one pharmacy if possible. Whenever possible, it's best to fill all prescriptions at one pharmacy. There are several reasons for this. First of all, it's easier for the pharmacist to screen multiple medications for potential drug interactions. The pharmacist can also look at all of your prescription drugs to be sure you're not taking multiple drugs that might have the same or similar side effects, therefore making side effects a lot worse. If the pharmacy has a list of all current medications you're taking and which medications you take together at the same time during the day, this also allows the pharmacist to be sure you're not taking drugs that might need dosage changes when they're being taken together. Some drugs do have special interactions with each other that require one or the other or both to either be increased or decreased in their dosage to produce the same effect. If a pharmacy doesn't have a list of all your medications in one place, they can't completely assess for these kinds of drug problems and interactions. And, as a result, they can't notify your prescriber if there are any such issues or problems with your prescriptions. Secondly, when you deal regularly with one pharmacy, they're more likely to remember you and any particular needs you may have regarding your specific prescriptions. Finally, dealing with one pharmacy usually ensures that they're familiar with your specific drug prescription plan, so they're able to correctly and more efficiently process payments and coverage for your different prescriptions. Number 4, regularly review all medications with your primary care doctor or other appropriate licensed healthcare provider. With healthcare practitioners treating so many patients who are on so many medications, changes in medication regimens can unfortunately get overlooked or fall through the cracks. It's crucial that you or your loved one have at least one qualified healthcare provider who's keeping an eye on and managing the sum total of all things that are being prescribed by all different providers and specialists you may be seeing. Unfortunately, It's not uncommon that one provider or specialist might prescribe a drug not knowing that another provider or specialist has provided a different drug that either overlaps or duplicates the drug's function or has significant side effects when the two drugs are taken together. Also, always be sure to advise your provider of any symptoms, side effects, or other problems you think your prescriptions might be causing. It's very important to be honest and straightforward with your healthcare providers if you're not taking your drugs as prescribed, either because you don't remember, it's too much of a hassle, or you're experiencing problems or side effects that bother you. Your prescribers can't appropriately manage your prescriptions and monitor the benefits of the medications that they think you're taking if in reality you're actually taking different medications or at different times of the day, or you're not even taking some of your prescribed medications. Finally, always remember to mention and have your provider keep a list of all over-the-counter medications that you may be taking. Just because a medication is over-the-counter does not mean it can have significant side effects or significant interactions with your prescription medications. And now we come to the fifth and final tip about managing multiple medications. Talk with your pharmacist, primary care doctor, or other appropriate healthcare provider to see if medications can be taken fewer times per day, taken at the same time, or even discontinued. It's not unusual that healthcare providers with their hectic schedules often don't consider all of the challenges and nuisances involved in taking multiple drugs. By discussing any challenges that you're having with your drug regimen, you and the prescriber may be able to make your medication program a lot easier for you to follow, while also minimizing drug interactions and side effects. By discussing any challenges that you're having with your drug regimen, you and your prescriber may be able to make your medication program a lot easier for you, while at the same time also minimizing drug interactions and side effects. Thanks again for watching. I truly appreciate your time and your interest in my content. Remember to like and subscribe. If you have any questions or concerns, discuss them with your qualified healthcare provider. Don't try to self-diagnose or self-treat. Until we meet again in the next video, stay healthy.